Welcome to Town Talk.
A brand new show brought to you by the City of Victoria. We're your hosts,
Ashley
and Shane. You'll hear stories of the city and of Victorians just like you who make it an awesome place to live.
That's right. So listen in to stay informed and entertained. Join us for Town Talk. Well, hey everyone, welcome to another episode of Town Talk. I'm your host, Ashley Strevel, Director of Communications, and today we have a very special guest. We've got our Fire Chief, Tracey Fox. Chief, welcome to the studio.
Thank you.
Our little
Good
makeshift
afternoon.
studio here. Good afternoon. So first, we like to ask, just as an icebreaker, if you could tell us a little bit about yourself.
Sure. Tracey Fox. You may see me as Robert Fox on email if you email me. But I've been with the city for almost 25 years now, and I grew up in the area, so love being close to home, if you will.
Yeah. What's a fun fact you can share with us?
I chase my 4 kids around, McKenna, Avery, Addison, and Andrew. I spend most of my time chasing them around and participating in activities with them and picking up after them.
Yeah, I bet that happens often.
Often.
So one thing that I wanted us to talk about today was what all your department does. Everyone knows fire department addresses fires, but there's a lot that they may not know that specifically involves responding to public health needs.
Correct.
Can you talk a little bit about that?
Sure. Yeah, as you said, most people recognize the name fire department, and we respond to fires, but that's just a very small portion of what we do. Right. We also provide EMS service, emergency medical services, along with hazardous materials response, technical rescue, fire prevention from our fire marshal's office. That's also under the fire department's purview or responsibility. As you mentioned, our EMS, emergency medical services, is shifting in recent years to more of a preventative measure, which falls in line with public health. And kind of our goal in 2020 was to get more involved with public health with the vision of providing services like vaccination services, improve health of the community, because that has a direct relation to our mission as far as the EMS goes. If we can keep our community healthy, we have reduced emergency medical service needs in the community.
Right. So what are some of those efforts specifically? What does it look like?
So in 2020, we kicked off a flu vaccination campaign. We did not envision at the beginning of 2020 that we would be dealing with a pandemic, but we were planning on doing a flu vaccine. So we conducted that, and that was more important than ever to do that with the pandemic that was occurring with the coronavirus. And that flu vaccination clinic allowed us or prepared us to be able to vaccinate the community when it came time to vaccinate for the coronavirus.
Right. So talk to me about at what point you guys realized, hey, we're not only going to be vaccinating for the flu, but now we're going to have to start vaccinating for this COVID thing. We didn't even know that was coming when it did, right?
Correct. Well, we were always preparing or that was always the end game, was there's to be a vaccination. So we recognized that at some point we would have to do that. And we early on applied to be a vaccine distributor. So we applied and went through that process very early. Therefore, we were one of the first fire departments, EMS agencies in the state of Texas to receive the vaccine in late December.
Wow.
Once we began vaccinating our first responder community, we then looked out to how we could vaccinate other members of the community. And what we found that we had a unique skill and ability to do was vaccinate our homebound residents. So we partnered with non-governmental agencies like Meals on Wheels and other nonprofit agencies to use their clients or use their list of clients to vaccinate the ones that were homebound and fit into the Phase 1B category, if you will. That has been very successful, and to date we've vaccinated almost 500 homebound residents. We plan to expand that program and to allow that to be provided to citizens of Victoria County that aren't affiliated with maybe a non-governmental agency but still have that need, can't get out of their house but need the vaccine.
Right, and so their way to get reached, I guess, or to sign up for the vaccine, there's now a website, is that right? There's
now a website. It's just like you would sign up for the hub, but it's called Homebound Waitlist. So basically the only expectation there is that the person have a medical condition that prevents them from leaving their home. They can sign up on this wait list. They have to be 18 years of age or older. And then we'll process that request and reach back out to them, schedule an appointment, and come to their home and vaccinate them.
Nice. So, people keep talking about Moderna and Johnson & Johnson and one-shot pill, all this kind of stuff. What is your take on that? What are you guys, having worked closely with Victoria County Public Health Department, foreseeing in the next month, in the next 2 months?
Well, we think and we hope that Johnson & Johnson will become more available here locally. One of the local hospitals have already received an allotment of Johnson & Johnson. Worked very well. It's a one-dose vaccination versus a 2-dose, which makes things logistically a little easier to manage. So that's a bonus. But the suggestion would be to anybody that's wanting a vaccine is to take what you can get. If Moderna's available, take Moderna. If Pfizer's available, take Pfizer. And when Johnson & Johnson's available and it's available for you, then you can take Johnson & Johnson. The efficacy rates of all those vaccinations are extremely good. So there's no downside to taking any one of those vaccines.
Right. So I believe I was in conversations with you guys talking about it eventually becoming available to the wider public, to not just 18-year-olds and up, but even beyond our vaccine hub, maybe to private companies, things like that. It may already be available, but what is that capacity looking like as well?
It's improving each month, each week. The capacity for the vaccine is improving and being more widely distributed in the community. And eventually what will happen is the vaccine will be so readily available, much like the flu vaccine is today, that you won't see these mass vaccination hubs or these mass vaccination attempts. It'll just be like a normal, typical flu season where you go to your doctor, you go to your pharmacist, you go to H-E-B, you go to some place like that to get your flu vaccine. And then there will be efforts, at least we envision that there will be efforts to help our vulnerable population, just like we did with our flu vaccine. That was really directed for vulnerable populations such as the homeless or low income that do not have access to those resources.
Right. And so I'm assuming that once we get there, it'll be a lot less taxing on your department's resources, probably Victoria County Department, all the other partners who are operating this vaccine hub.
Exactly. The vaccine hub, most people may not be aware, but it is the one in Victoria specifically, is extremely labor intensive for the key players: Victoria County Public Health, Citizens Medical Center, DTAR Hospital, Victoria Fire Department, City of Victoria, County of Victoria. They're providing the workforce to do that, and it takes them out of their regular job. And so it is very labor intensive and very taxing on all those agencies. And yes, we hope to get to some day where we can scale back that effort.
Right, and that effort includes the hotline.
Hotline,
of course.
exactly.
I work for the city, obviously, and so we see our departments volunteering for answering phone calls and registering people. So you can definitely see when there's a silver lining.
Exactly. And
we
we hope that sooner than later. The main reason is because that means the community is being vaccinated to the level in which they want to.
Right, exactly. So let's rewind a little bit. We've talked about all there is about the vaccine hub, but can you tell maybe our viewers, maybe y'all are interested, what is one of the most challenging things that you experienced in getting that going? And then maybe once it got going, one of the biggest challenges we faced?
The vaccine hub?
The vaccine hub.
Well, the biggest challenge has been, at least in the initial phase, is knowing if and when we're going to receive the vaccine. So it's very hard to plan for vaccinating 2,000 to 3,000 people when you don't know if and when you're going to receive the vaccine. So vaccinating 2,000 people takes a lot of planning and scheduling. And if you don't know or till the last minute that you're going to get the vaccine, it becomes very challenging. So that was the initial challenge at first. Here lately, staffing, as you mentioned, has become a really big challenge, and we've had to reach out for some help, not only to the region but to the state to help with some assistance on our clinical staff to be able to vaccinate 2,000 to 3,000 people a week.
Right. So the biggest challenges in the get-go was figuring out when we were going to get the doses.
Correct.
And talk a little bit about how you have to be very specific about the storage of those vaccines. It's not like we could get them and say, next week we'll go ahead and host a vaccine. It's like within, 24, 48 hours?
Correct. So the vaccines are very specific on how they have to be handled and stored and then administered. So I'll just use Moderna, for example, because that's our experience and some of the challenges we run into. Once we start a vaccination clinic and we open that vial, we have 6 hours to get all those doses out.
Right.
And if we don't get those doses out, they're wasted. And obviously, this is such a precious resource. We don't want to waste it. So we find ourselves at the end of the day sometimes scrambling, trying to find those last minute people to vaccinate. And that's a challenge. It's like I said, it's a mad scramble at the end of the day to try to find some people to take the last few handfuls of vaccine that you have. But that's what we do because we feel like it's such a precious resource. We don't mind going to that effort and reaching out to different groups. And it's funny, all agencies that have been vaccinating have created this, we call it a standby list, just for that event. In the beginning, we never envisioned that happening. But with the complexity of handling the vaccine, we had to go to these almost emergency standby lists so we can quickly get out these last-minute doses that are about to expire.
Right. It's been a big learning process.
Absolutely.
And you don't know, or you can plan ahead as much as you want, but you don't know until you're in the midst of it.
Right, exactly.
So that's one example. So what else have you learned this year? I mean, maybe it's related to COVID, maybe it's not.
Yeah. I think the ability of our community to adapt and overcome to a situation. Really, our vaccination hub is unique in that it is a conglomerate or cooperation of multiple agencies from different perspectives that really just have a common interest in serving the community. And they really want this community to be healthy, be well, and they want to succeed for their community. So that's what I think is come to light once again. Typically in a disaster, we see that, and this particular disaster is no different than a hurricane. You know, you have these different people, agencies, groups coming together to ensure this Golden Crescent region is successful and safe.
Right. And it's not easy, but it happens.
Not easy.
Make
Exactly.
it happen. Well, speaking of wanting to make, I guess, Victoria better and make it a safe place, what efforts could you talk about beyond COVID, beyond the vaccine hub that the fire department is undertaking?
Sure. One of the things we do, and we're really looking forward to getting back into this, is our community education piece. That's one of the things that's been challenging, if you will, during this COVID pandemic, is that our contact with the community has been limited just due to protecting our workforce and protecting the public. So we're really looking forward to getting back out there and doing those educational events. One of the things we did do, we were able to pull off in 2020 was during the Southside cleanup, we were able to install over 100 smoke detectors in one day during that event. And that was the first time we've ever done that. And it will now be our model for the future. And we're looking forward to doing this. Is having these one-day neighborhood-wide installs of smoke detectors where we can do up to 100, 150, 200 smoke detectors a day. Because our ultimate goal is to have 90% of the single-family residents in Victoria with a working smoke detector, because we feel like, one, that'll reduce property damage, two, for surely save lives. So that's our ultimate goal, is to really prevent the damage and pain that fire causes.
Right. And so let's say they already have a fire alarm, smoke detector. Then you can always just give them batteries, right? That's part of what you guys do
we
too?
can either upgrade it or, and that's part of the assessment as we go into, we can come into the home and say, well, you have one, but you really need two.
Right.
So we can do that, assist residents with that. But a lot of times what we find is just human nature. People do well, put a smoke detector up, and a few years later the battery's dead, and they never think to change it or replace it. And, what we've done now is we've purchased these smoke detectors that have roughly 10 to 20 year lifespan on them. So that stretches that period out that the smoke detectors works in the home. So that's one effort we made, or improvement we made to the smoke detectors. So that helps. We also receive a lot of donations and grants. That's how we fund that program, is through donations and grants through various agencies like Lyondale-Basell have been very generous to us over the past years for our smoke detector program, and other insurance companies in the community. But that's how we fund that program, is through grants. So we're always looking for support in that to fulfill our goal. And we call it Fire Safe 2025. We want to have 90% of the single-family residents with a working smoke detector by 2025. So that's our goal.
That's a really good goal. So what else are you guys looking forward to in the next few years?
What we're looking forward to the next few years. Well, like I said, we're really looking forward to getting back involved in the community face-to-face. So we're really looking forward to that. We're looking forward to expanding our EMS into, like I was saying, more of the public health model, in which we call it community paramedicine. and it's a new trend that's happening in EMS, and where you're trying to prevent or really address the needs of the patient. Right now, the only access to medical care that a lot of people have is to dial 911, and that's really not the most efficient means of providing medical service to them.
Right.
Because right now, the way the processes work, they have to go to the hospital.
Right.
That's a very expensive bill,
Yes, it
along
is.
with the EMS bill. So what we're going to try to do is shift our model a little bit, and not send an ambulance to those particular calls or a fire truck. We're going to send a smaller one-person vehicle that can go out and do services that they really need. And really what we found, because we've piloted this program a little bit, is that they need almost a social services type person to help connect them with the services they need,
Right.
particularly for the elderly. It's Meals on Wheels. It's we found that home health, we get them involved, and that helps the situation. Or sometimes we even find out that people really need to get into a nursing home or assisted living facility. That being at home by themselves is not the best for them,
Right.
and we can come in and help facilitate those services.
Kind of function as a liaison.
Exactly.
That's awesome.
We identify that because they have no other mechanism to reach out to those services.
Right.
So what they wind up doing is picking up the phone, calling 911 because they have a situation going on, and then that causes us to send, not the appropriate resource to them.
Right.
So that's how we're going to shift our model, make it a little more efficient, make it better for the customer, and get them the appropriate services they need.
That's awesome. So, if the community wanted to give back, get involved in any fire department efforts, what would they need to do? How would they be able to do that?
Yeah, so two points. We just finished up our first civilian responder program, which is formerly our Civilian Fire Academy. And out of that program, we have an alumni association that you can become part of. You just reach out to the fire department to get more information on becoming a Fire Corps member. And that group is they're a volunteer group attached to the fire department. And they help the fire department out in many efforts, from providing rehab at large fire scenes to they've been heavily involved in the vaccination hub. Our Fire Corps group has been involved in volunteering in that almost at every event. So that's a great way. If you want to become a member of the fire department, a paid working member of the Victoria Fire Department, Victoria's got a great opportunity for you. Victoria College offers an EMS program, an EMT, to get certified as an EMT, and the Victoria Fire Department provides a fire academy that we do once a year, open to the public. You don't have to be employed by the city of Victoria. It's open to the public just like any other college course or certification course, and you become a certified firefighter and hopefully get hired on for the Victoria Fire Department.
That is so neat. So you mentioned the civilian. Oh my gosh, that is so neat. So you mentioned the civilian responder program. So how often do you have those, and when are they held?
This was our first year to have the civilian responder program. We
Okay.
typically have those in the spring. We have them once a year. We try to coordinate that with the City Citizens Academy, and police has their academy as well. But we have those once a year, and really the goal of that program is to empower citizens to respond in an emergency.
Right.
We teach things like hands-only CPR. We teach things like stop the bleed, how to control major bleeding, EpiPen assist, the pen, We've also added Narcan administration, which is pretty cool, and how to use a fire extinguisher. Those type of things. So we try to teach our citizens how to respond in an emergency. They could save their family's life or friend's life, or they could just be out in the public at a large event or at shopping at H-E-B, and some emergency happens, and they can intervene and save a life.
That is so cool. And you never know when that's going to happen.
You never know what's going to happen.
Yeah, it's good to be prepared. So we've talked about a lot. Can you tell our viewers or whoever is watching, listening in, how to get in contact with your department if they wish to?
Sure. You can go to the city's website, which is
victoriatx.gov, and in this case, /fire.
exactly. Or you can call the Victoria Fire Department Administration Office at 485-3450.
Awesome. Well, any other fun facts you may not have shared?
Wow. I'm going to start coaching my daughter's volleyball team this
Nice.
week, so that'll be exciting.
Nice. How
Keep me
old is
on-
she?
I have 13, 11, 9, and 7.
Pretty good variety there.
Variety,
Keeping
yes.
you guys busy.
Keeping us busy.
So the big question of the day is, how about that dairy treat by what is it?
Man.
Fire Station
Station 4 is excited
4.
about having Dairy Treat next door. Just buzz right over there, pick up a quick meal,
Exactly.
and get back. A real local treasure here in Victoria,
It really
Dairy Treat,
is.
expanding to 2 locations.
Yeah, it really is. But
Close to your fire station.
the best thing, what's your go-to meal? I'll just go. Mine is strawberry milkshake.
Strawberry milkshake. I like the butterscotch milkshake.
I've never tried that.
Yes.
Really? I thought they only had vanilla, strawberry, and sherbet.
Somebody tipped me off to it. I don't think they advertise it, but I asked for it and they have it.
How funny.
Yeah.
Maybe it's like Starbucks' secret menu.
I guess so.
We'll have to check it out. Thank you all for tuning in to today's podcast episode of Town Talk. We appreciate you guys for tuning in, and stay connected with us by visiting victoriatx.gov/communications. We'll see you next time.